Is this another COVID? Is there going to be a lockdown? These are some of the questions in the hearts and the mouths of people. So we are diving into something that you might have heard of but may not understand. In this video, I'll be sharing with you vital information on HMPV. That's the human metapneumovirus. Now, it's in the news currently as at the time of this video. China, Kazakhstan, India, some other countries are said to be affected currently. In fact, some people think this is another COVID. Is this another COVID? Is there going to be a lockdown? These are some of the questions in the hearts and the mouths of people on this virus. It's important to have this information so as to know how to protect yourself and your loved ones from getting this virus. So the HMPV, that is the human metapneumovirus, is a respiratory virus. That is a virus, a type of germ that causes illness of the respiratory system. So it's like the common cold, like respiratory syncytial virus, like influenza virus. These are viruses that are responsible for respiratory symptoms. Sometimes we call common cold, and these symptoms include cough, fever, sometimes runny nose. This HMPV is one of those viruses. But the question is, what is really happening at this time? What is this virus? What are the symptoms that an individual with this virus will manifest with? And then how do we know who has been infected, who needs to see a doctor, who needs treatment, and ways to protect yourself? Stay tuned. So the HMPV is RNA virus. It is common during the cold season, about the winter through the spring season, and it is one of the causes of common cold in different regions of the world. One major cause of the spread of this disease is the contact with persons that have been infected. So you can get infected coming in contact with persons who have been infected, coming in contact with surfaces that have been infected by touching those surfaces, or by exposing yourself to the droplets, call them head droplets, that an individual who has this infection spreads by coughing, by sneezing, and by touch, any form of contact with the surfaces that have been contaminated by these persons. This is especially common in children and older adults and those with weakened immune system. So we have to stay cautious, especially this season. Now let's talk about the symptoms. Symptoms of HMPV are similar to those of other respiratory illnesses, and these include cough. The cough may or may not be productive of sputum, includes fever, includes sneezing. In fact, individuals may also have what we call a runny nose, catarrh. Some individuals may have a sore throat, breathlessness, difficulty in breathing, and such will require immediate evaluation and support for respiration. The symptoms are particularly worse and may progress into bronchitis or pneumonia in some individuals. Individuals with underlying lung conditions or respiratory diseases may have worsening of these symptoms. For example, individuals with bronchial asthma may also wheeze, having noisy breathing when infected with this virus. So if you are experiencing any of the symptoms I've mentioned, then you need to visit your healthcare provider. If you know anyone with these symptoms, they should be taken to the hospital for proper history taking and proper examination, and the lab test will be done to confirm the diagnosis. A sample in the respiratory tract is usually taken, and blood samples may also be taken to check for the presence of the virus and other related infections. Now that you know the symptoms of HMPV, let's look at how to protect yourself and your loved ones from getting this virus. Most of respiratory illnesses, especially the common cold, have the same approach to prevention. Washing of your hands frequently is very important at this time and for preventing this infection. Avoid close contact with infected people. The question is, how do you know a person that is infected? Now, from the symptoms that I have mentioned, the fact that some individuals may have worsening symptoms and may require seeing a healthcare provider is one way to identify persons with this infection. Cover your mouth when you cough or sneeze. Encourage individuals around you to cough into their folded palm, to their elbow, and also when they sneeze. However, they can also use tissue to cover their nose to prevent spread of this virus. It's also important to use sanitizers at this time. This will help to remove viruses and other forms of germs that may be present in the environment. The use of face masks is also very essential at this time. This will not only protect you, it will also help to prevent spread of this virus. Finally, disinfecting surfaces, contaminated surfaces, very important. To clean surfaces such as tables, chairs, and other platforms that are easily contaminated with germs in our environment. The way to boost your immune system is to take healthy diet. You should engage in taking balanced meals containing vegetables, fruits, and of course healthy fats and protein. Next is hydration. Adequate hydration is very essential. Helps to clean the system, help to replace even fluids that are being lost during respiratory illness. It is very important to get adequate rest. This helps to also boost your immune system. Taking foods rich in vitamin C like citrus fruits can really be helpful. So since there is no specific treatment for HMPV, some people may actually present to the pharmacy and get over-the-counter medications which may help to take care of symptoms. But if symptoms are worsening, individuals should see their healthcare provider for proper evaluation. So there are various ways that you can prevent getting this infection, and these are similar to other ways of preventing respiratory diseases or illnesses. These include the use of sanitizers, and sanitizers are very important in helping to remove germs and even viruses from our skin, especially using them on your hands. Now, there is the important role of hand washing with soap and water. This is very important. Regular hand washing with soap and water will help to prevent getting this virus. Avoid getting in close contact with people with respiratory symptoms. With these symptoms, or persons that have been confirmed to have this virus, until they have had proper treatment. Cover your mouth when you cough or sneeze. Then disinfect thoroughly surfaces that may be contaminated with this virus. But to boost your immune system, you need to maintain a healthy diet. Very important. Take fruits and vegetables, healthy fats and protein. Of course, hydration is a key aspect of prevention. This helps to also boost your immune system. It helps to cleanse your system of toxins, and taking water adequately also helps to rehydrate. For people with respiratory symptoms and people who are losing more fluid than usual will benefit from extra fluid intake. So you need to take foods rich in vitamin C, such as citrus foods. This will really be helpful for you. And don't forget, you need to rest adequately. Rest will help to also boost your immune system. Since there is no specific treatment for HMPV, some people with respiratory symptoms from this infection may not know, because sometimes the symptoms are actually mild, maybe moderate and severe in some cases. So most people may go for over-the-counter medications to take care of the symptoms, and they will surely recover. But there are few cases that may need to actually get treated in the hospital, especially those with difficulty breathing, those with prolonged symptoms and not resolving, people who have more people around them with similar symptoms. This is a time to actually ensure that you stay safe, as the current update from China shows that there are increasing numbers of people with these respiratory symptoms. Now that you know the basics of HMPV, human metapneumovirus, the symptoms, how it spreads, the prevention steps, you can stay safe and healthier this season. If you found this video helpful, remember to click on the like button. Remember to also subscribe so you can get updated information and similar information on health, wellness and lifestyle. Also share this with people around you, friends, family, colleagues, members of your community, so that there will be increased awareness of this disease. So everyone should stay safe, keeping fit. Thank you for watching. Bye for now.